So you are taking a plant, you are putting it in water, submerge it for 2 days, and what will happen? The plant will get decayed. Yes, you cannot survive underwater because it's supposed to be above the ground. It cannot be underwater, so it will decay. See, the problem in varicose vein is the same. Here there is a severe swelling. The swelling is water, and water should not be there. And because if you touch here, you can see that it is a pitching edema, swelling of the leg. The swelling is going to cause the real problem. Okay, when there is more than enough water there, the cells around the cells is going to get decayed. The cells decay, infection happens. Infection sets in. Okay, so then the patient is having cellulitis. That is the reason why varicose vein is having infection. Varicose vein patients will have infections in the future. Okay, this is the natural progression of the disease. And when the hemoglobin goes out, you will have itching sensation. Suppose the patient is scratching this area. There is a small wound here. Okay. So do you know that your skin is the most important protection which God has given us against all the microorganisms in the world? If there is a breach in the skin, the microorganisms has an entry point. So microorganisms are going to attack you if there is a small wound. And when it enters the wound, what will happen? The microorganisms or the bacteria finds that there is a lot of water to drink, there is a lot of decaying material, you can have a lot of food, they will grow and they will become, they'll multiply there. When the bacteria multiply, the infection spreads and the patient will have severe pain and cellulitis. So this is the progression that is going to happen. And what will the body do? We have our own defense mechanism. So if there is an attack, we'll attack back. We'll attack back and try to contain the infection. Initial stages, we'll be able to contain the infection. But later on, it won't be happening. Why? Because there are two problems. One, varicose vein is not taking the blood back up. There is a flood in the area. So you cannot have the control of the infection. So at last, the infection cannot be controlled. The patient will have, initially ulcers will heal. Later on, these ulcers will refuse to heal. So that is the problem that is going to happen for any varicose vein patient if it progresses. Okay. So this is how the varicose vein problems are happening. This is the chronic complications of varicose vein. Suppose you have varicose vein, it can cause chronic complications. Okay. There are acute complications which I will come to later on. But what are the reasons for having varicose vein? How can we prevent the varicose vein? First thing is genetics. If you have somebody in your family or parents having varicose vein, then you definitely are having a more probable chance of having the varicose vein problem. Another thing is prolonged standing or sitting. So prolonged standing means if you are standing for a much period of time, the blood is not able to go up. When the blood doesn't go up, venous pooling is happening. The symptoms which I have already explained will happen, and this will be a big problem. So every half an hour, if you have a standing job or in a profession which requires long standing, it will be advisable to stretch your legs and walk around a little bit so that you will avoid the pooling of the blood. Okay. And prolonged sitting. See, when you're sitting now, do you know that the blood is able to go back towards the heart, but it is more difficult than standing. When you're sitting, what happens? There are two kinks are there. At the knee level, you have the blood needs to. There is a kink in the vein, and then at the hip level, it has another kink. So there are two obstructions in the flow of the blood. So it's more difficult for the blood to go up, and thus causing the blood to pool in the legs and causing symptoms of the varicose vein. So it will be always advisable for a person to stand up in between. If you are an IT professional, or somebody who sits for a prolonged period of time, or somebody who has a sedentary lifestyle, will always be advisable to get up every half an hour, walk around, drink some water, come back, and if you do that, the varicose vein problem will not be progressing. That will be better for you. Pregnancy is also another risk factor. So now we come on to the acute complication. What is acute? Acute means instantly happening. Suddenly some problem is there. Suppose you have varicose vein, suddenly some problem happens. The problem which I explained now, the ulcer and all, is a chronic complication. That is, if you have varicose vein, over the years together, it will convert into a big problem. But you also can have acute problems like bleeding from the varicose vein as well as thrombophlebitis. Okay. So we'll go into each of them. You can see that this patient is bleeding from the vein. So anybody who is having a varicose vein can bleed. Usually it is not very common, but if you bleed, you can bleed again. The rupture of the vein walls, that is happening. The varicose vein is not a normal vein, it is having a defective vein which is able to bleed. So when it bleeds, there will be no pain. That is the reason why when people are trying to suicide, they cut the vein because there is no pain. Bleeding from the vein is painless. So that is why we always say this bleeding is painless. But this itself is the biggest dangerous thing for varicose vein bleeding. Because I have seen patients who are saying that they will say that doctor, I didn't understand that bleeding is from my own blood until I found out that I was standing in a pool of blood. It was blood all around, but I couldn't find out where the bleeding is from until I looked at my feet. It was from my own leg that I was bleeding. Okay, so that is the problem with varicose vein. It's a very dangerous thing to happen because you'll be scared. You'll be scared like hell because you're seeing a lot of blood and you will not understand what to do. So here I'll be giving a tip what to do. First of all, don't rush to the hospital. Yes, when there is a varicose vein bleed, what to do? You don't rush to the hospital. I'll explain why. Because if you rush to the hospital, what happens? The blood will be going into the leg again because muscles are working and there will be more bleeding. Instead, what you can do is you should lay down there. Whenever you find that you are bleeding, you should lay down or keep your leg up and apply little pressure over the vein at the bleeding point so that the bleeding is completely stopped.